Welcome to the Root of Information.
Hello viewers, it's Dr. Zakar Rafiq. I'm a hair transplant surgeon based in London, and today I want to talk you through a common term which is bandied around called alopecia. Now, alopecia is a medical term, but it seems to mean all sorts of things, all different types of patients as well. And so today I want to demystify this term. Alopecia actually means hair loss. It's an umbrella term within which it incorporates many different subsections of hair loss, like alopecia areata or androgenic alopecia. So it doesn't necessarily mean the alopecia that you think about when you have a round, patchy hair loss. That's often caused by an autoimmune condition called alopecia areata or even a fungal infection. Right, let's talk about the facts now. Switch on. And we start off with androgenic alopecia. This is a huge problem and affects both men and women. 50% of men above the age of 50 will suffer from some form of male pattern baldness. That's what you get classically when you start losing hair temporarily outside of the temples and also at the crown. And it also extends back and extends forward, and eventually you're left with this patch of hair. Interestingly enough, it's that patch of hair that we use to hair transplant patients. That's called the donor area. Aside from that, there are other types of alopecia that you need to be aware of. One of which is a circular loss of hair or a patchy loss of hair, which is called alopecia areata. But it can be also caused by other forms of alopecia like tinea or fungal infection. Another common form of alopecia is something I've touched on before, traction alopecia. This is where you put pressure on the hair follicle by pushing the hair back, and because of that, it affects the follicles at the temples and at the back of the head and neck. Common in certain subtypes of patients, like Afro-Caribbean patients who braid and weave, or patients from the Sikh community who often put their hair into a turban. So braiding, weaving and pulling your hair into a turban can actually make your hair loss worse, particularly at the sides of your hair. Do not put too much pressure on your follicles. What's clear is that the symptoms of alopecia can vary from one type of alopecia to the next. What's even more important is that you recognize these and seek medical advice early. So see someone like myself, a hair transplant surgeon, or your GP, and you start experiencing this form of hair loss. Let's start fighting this early and successfully. Thank you for today. Hope you enjoyed this video. Till next time, have a lovely day.